Hello, guys. I want to go ahead and welcome everyone to our Lunch and Learn. This Lunch and Learn is being brought to you by collaboration between Oklahoma Human Services, University of Oklahoma, Ann and Henry Zorro School of Social Work, and the Center for Adoption and Family Wellbeing. We appreciate everyone joining during our lunch and noon hour. We want to go ahead and get started so that we can make sure to respect everyone's time and get the great information being discussed today. First, we're going to go over a few housekeeping things just for our time together this afternoon. First, we are recording this meeting. By participating, you are giving your consent to be recorded. To help us reduce distractions so we can all focus and participate, we have already muted everyone to make it possible for everyone to hear the speakers, but we do want you to express your thoughts and questions, so please utilize the chat for this purpose. We will monitor the chat and questions will be touched upon during the Q&A time during the last 15 minutes of the teaching. We want to see you. So if you're willing and you can, please go ahead and turn on your video. If you're unable, that is fine also. To receive information about other post-adoption events, please go ahead and list your name and email in the chat, and we'll make sure to add you to our contact list. 3, we're going to go ahead and remember confidentiality. It is vital that we protect our confidential information so that we do not share specifics about foster and adoptive cases. All materials from this presentation will be available to you after the presentation. You will receive an email including a link to the resource database. And now I'm going to go ahead and hand everything off to Shandy Cott, who is today's host.
Hi, everybody. Can you hear me okay? Yes. Okay, so let's get started. Is there a way that you guys can bring up my presentation? I have it if you can share your screen with me.
You should have access to share the screen, but if you would like for us to share, we can do so, whichever is going to work best for you.
Okay. It's really, if you want to, you can go. Do you have my presentation on hand?
We do have it. I can pull it up if you'd like, but it's totally up to you what you'd like to do.
Okay, I'm fine with that. Can I click through it if you bring it up?
If I pull it up, you won't be able to click through it. You would have to share your screen to be able to click through it.
Okay, let me see if I can share my screen. I don't do this very often. Usually I'm the host and the presenter. So tell me real quick, how do we get going on that? If I'm
You
going to
should
share.
be able to click share screen down at the bottom.
Yeah.
And it should give you access to do so. You've got it.
Okay.
Now we're seeing, your main screen, and now your PowerPoint's coming up. Perfect.
Perfect. Okay, thanks for walking me through that. I always have a little bit of a,
No
how do
problem.
I
I
do
understand.
this?
Sometimes
But
when
nope.
another person is the host, it gets confusing. You're
Yeah,
all
okay, so
set.
let's get started. Okay, we don't want to take too much time because we have a lot of information, and I'm hoping that we have enough time for questions at the end because I know you guys want to have that available time. Okay, so I am Shandy Cott, and I am with the Autism Foundation of Oklahoma. I am a social worker and a certified autism specialist. Also, just to let you guys know, I have 2 children, both in college right now, and my youngest has autism. So I have ties to autism in a personal way as well. So it's a very passionate subject for me. So I may use some not just professional things as we're going through this, but also throw in a little bit of some of my personal stories as well. Um, Okay, so let's get started. So, a little bit about Autism Foundation of Oklahoma. We are a nonprofit organization that serves the entire state of Oklahoma, and we also serve the lifespan. And our mission is to improve the lives of Oklahomans with autism and their families. And we do that through these program areas. And if you have questions about the programs, you can always reach out to me. I'm going to share the QR code again at the end that you guys had saw earlier with my information. But these are some of our areas that we specialize in, and we have trainings in some of these areas as well, not just what you're hearing today. So we have advocacy and community outreach, children and youth, public health and safety, and transition and employment. So I had kind of clicked on this a while ago, but didn't want to do it too prematurely. So now let's talk about the course objectives. So today we're going to look at the latest facts and characteristics of autism spectrum disorder. We're going to learn about autism spectrum disorder and mental health and how those co-occur. And we're also going to look at common interventions and supports, as well as learn positive tips for interaction. And so those are going to be our main focus areas. So let's dive into important facts. So what is autism spectrum disorder? And I'll call it ASD and autism, kind of go back and forth on those. But what it is a developmental disability that can cause significant social, communication, and behavioral challenges. And so there's usually nothing about how someone with autism looks that sets them apart from others, but it's the learning, thinking, and problem-solving abilities of people with ASD that can range from gifted to severely challenged. So some people with ASD are going to need more support in their daily lives than others. And we'll talk more about that as we go through this. ASD now includes several conditions that used to be diagnosed separately. So I'm sure you guys have heard of Asperger's or autistic disorder or pervasive development disorder. So all of those things used to be diagnosed separately, but in 2013, they updated the DSM-5, which is the diagnostic manual used for identifying psychiatric disorders. And that's when they put all of those different diagnoses under one, which is autism spectrum disorder. So let's talk a little bit about some co-occurring conditions. And so I just want to say that more than half of people on the spectrum generally have 4 or more other conditions. And these conditions that overlap with autism generally fall into one of 4 groups. So you have classic medical issues or conditions, and the ones that usually co-occur with autism more commonly are epilepsy, gastrointestinal issues, or sleep disorders. Also, there's going to be developmental diagnosis such as intellectual disability and language delay. Mental health conditions, we're going to talk about that in its own little section, but it's very common that they co-occur with autism. And the more common ones are ADHD, obsessive compulsive disorder, anxiety, and depression. And then also you're going to see some genetic conditions also co-occur with autism. And the one that comes to my mind right off the top of my head is the Fragile X syndrome. So when someone has autism, just remember that there's going to be other things and other diagnoses going on as well. I want to hit on intellectual disability prevalence in ASD. 31% of children with ASD have an intellectual disability, 25% are in the borderline range, and 44% have an IQ score in the average to above average range. So the latest research from the CDC estimates that approximately 1 in 36 children have autism, and an estimated 5,437,000, it's well over 5 million people have, adults have ASD, and it's over 2% of the adult population. And the more we learn about autism, the more people get diagnosed. Those numbers just keep rising. Every couple of years, the CDC comes out with new numbers and they just keep rising. ASD occurs among all racial, ethnic, and socioeconomic groups. And signs of autism first appear in very early development. We're getting research from studies that have recently came out that kids can be diagnosed as young as 12 to 18 months now. And what are the common characteristics? So I don't know if you guys have heard Dr. Stephen Shore has a quote that says, if you've met one person with autism, you've met one person with autism. And so everybody with autism is very different. That's why it's a spectrum. So you may have one person that has some of these characteristics where others do not. So not everyone will experience all of these. This is just the more common ones that you'll see. So avoiding eye contact is very common. A lack of eye contact is a well-known symptom of autism, and it suggests that people with ASD are generally less engaged with others or less responsive to people in general. Overstimulation, you may hear it called OS, And this occurs when there's too much of an external stimuli in a person's brain to process information effectively. And it can lead to a very unpleasant sensation. And many individuals, when they're overstimulated, will try to escape that situation altogether or that environment. And some individuals actually explain it as a form of pain. So just remember that that's also very common. Narrow or limited interest, I like to call this their passion. This is going to be when an individual is very fixated on just one or two interests in life. Maybe a child only wants to play with one toy or wants to watch the same television show or movie over and over again. Sometimes it's a hobby that they're very interested in. Maybe it's a particular animal or airplanes, computers, a certain video game. But it's something that's going to grab all of their attention. And the issue with this is it limits their opportunities for appropriate socialization. Repetitive behaviors is also very common. You're going to hear this called stimming. And this is where someone may rock back and forth, spin, make unusual noises, blink their eyes repetitively. A lot of people refer to this as self-stimulatory behavior. And so, like I said, all of these are very common. You're going to see stimming in many cases. Limited social skills is also super common, and it's just where individuals with autism struggle on how to get to know others. Autistic children will have maybe some issues or concerns with trying to get to know their peers or play with other children their age. Maybe they have trouble talking to other people or building relationships. Autistic children are bullied far more than their neurotypical peers. So that's also very common. Wandering is also something that you're going to see. And this one is can be very dangerous because if an autistic child wanders away from home or school to maybe go seek out something that they've done previously that they enjoy, maybe they want to try to find a park that they recently visited. The issue with this is that they are not always, they don't realize the social dangers. They could wander into traffic. They could wander away from home and not know how to get back, maybe get lost. Also, autistic children have a tendency to gravitate towards water. So drowning is a huge concern when these situations happen. Sensory sensitivities is when an individual is going to have an unusual reaction to the way things in the environment look, smell, taste, feel. We're going to talk a lot about sensory sensitivities and sensory overload in just a little bit. But this is where you're going to see some of those stereotypical behaviors come out, like flapping hands, spinning, toe walking, making the unusual noises. Rigid routines is also something that we see a lot. A lot of autistic people are going to get into a routine where they like to do the same thing at the same time every day. And so when this routine is disrupted, this is where you could see some agitation or behaviors. Limited social communication skills. This is where you're going to have maybe a difficult time communicating effectively. If the individual is nonverbal or verbal, they may have difficulty understanding questions, or they may respond out of context. For example, they may simply script from a movie or want to talk about their special interest or ask repetitive questions. This is at times, if you're trying to have a conversation or ask questions, you may have to just go back to those and allow them to talk about what's on their mind and then revisit your questions at another time. Delayed auditory processing. This is not that the person cannot hear. It is that they have a difficult time processing sounds. So they may have a difficult time making sense out of or perceiving what they heard, especially if it's a noisy background or if they've missed a word or two in the question. So let's hit on ASD and mental health. So 78% of autistic children have at least one mental health condition. About half of autistic kids have 2 or more mental health conditions, and anxiety affects about half of those with ASD that have a mental health condition. And it's important to know that suicide is a leading cause of death among those with autism. Let's hit on trauma. So, what is trauma? And this is something that we could talk about for hours, but I want you guys to know we have so much information to go through that we're just going to hit a little bit on each of these. Trauma is exposure to actual or threatened death. Witnessing that is trauma. Abuse and neglect, someone that has been seriously injured, maybe physical violence or sexual violence, or they've witnessed someone being physically or sexually abused. Chronic neglect of basic needs, especially for very young children. And exposure to trauma and maltreatment. Some of the research that we've seen, and we need to do more, we need to study this more, but we're seeing that kids with autism have a higher rate of experiencing trauma and maltreatment. And so what are some effects of trauma? So you're going to see children with autism have a higher rate of anxiety and depression, which leads to a lower quality of life and more mental health concerns, PTSD. And people with autism may develop a specific type of PTSD that it's kind of like more like hyperarousal. And then this can include being very easily startled or having trouble focusing or concentrating on task, or insomnia. And we had already talked about that sleep disorders co-occur commonly with autism. So when there's also trauma involved, it's just makes that situation even more difficult. Emotional disturbances. Trauma can cause neurological changes that mimic autism and can lead to dysregulation. And individuals with autism, they already struggle a lot with self-regulation. So when you put trauma into play with all of these other things that are going on, it can be very difficult for them to cope. Also, a loss of hope. People with autism lose hope in developing meaningful relationships when they've experienced trauma. They have trouble with trust. They tend to isolate themselves more. And so as we move through the training, we'll talk more and hit on this, a little bit throughout, and you'll be able to understand where I'm coming from with this. But the best thing to do, we know that they're going to need counseling and individualized support in a very supportive environment. Also, individuals with autism are going to have possibly different effects from grief and loss. So they may show typical signs of grief and loss, but it's good to know that with autism, you may see some differences that include having a difficult time being able to connect with their emotions. When you expect them to cry or show emotion, they may not. They may have a delayed response in their emotions where it comes days, weeks, or even months later, or they may have an extreme emotional response. They may also experience an increase in their autistic traits. Their sensory sensitivities and differences may be heightened during this time. They may have more meltdowns or shutdowns. You may see that they're having a really difficult time organizing, planning, and concentrating on tasks. They may find it just much harder than usual. And they may have a difficulty understanding what to do in social situations, such as hospital visits, if there's a terminally ill family member, or funerals, for example. And so it's really important for us to be able to help in these situations by including them in rituals, ceremonies, and routines. Also, autistic people need to be supported to understand, express, and cope with grief, and talk to them about the situation rather than avoiding it. So I think a lot of people think that If they're struggling with it, just not talking about it may be easier, but we really do need to talk through it with them and help them prepare for the situation and provide them with information. And when I say this, it's because autistic people do much better when they know a plan or they know what to expect. So you're going to want to use very direct, simple language and explain to them. We'll just say perhaps they're going to be going to a funeral and they've never been to a funeral before. Maybe it's a young child and they're already struggling with these emotions. Helping them kind of be able to visualize what they're going to be seeing, what may be happening, how long this may take, who may be there, what's appropriate behavior and not during these times are extremely helpful. Also, autistic individuals struggle with identity at times. And so these are some of the more common things that they may be going through, especially for the teens and young adults. Self-awareness is a big one. They may have a hard time developing a sense of self-identity, who they really are. Also, camouflaging and masking is huge. Especially in teen and young adult females that have autism. So you will see that a lot of autistic individuals, when they get in social situations, they try to camouflage their autistic traits or behaviors to fit in with non-autistic cultural norms. And this, what it does is it leads to feelings of self-deception and betrayal. It is emotionally and mentally exhausting for them, but they have this feeling that they're different than their peers. And so what they try to do is act like somebody that they're not to fit in, but it's much more than what a neurotypical peer would do to fit in, because they just it overtakes them. And it generally leads to feelings of isolation, not being good enough, confusion, which then leads to more mental health conditions, such as anxiety and depression. And we already talked about that suicide is a leading cause of death for autistic individuals. So these are the type of things that push them to that point. Ableism is a system of discrimination that can affect people with autism and other disabilities. And when I'm saying what I'm referring to is stereotypes, functioning labels, and the language that we use. And social habits. The perspectives of influential people like peers, even teachers, parents, siblings, those perceptions that we have on just society can sometimes negatively impact their identity. For example, social habits may be forced without considering the person's wants or needs, and this leads them to feelings of shame, guilt, and isolation, which, just like what we were talking about with these others, can lead to lower quality of life, more depression, anxiety, things like that. And then social identity. This theory suggests that people can sense self-esteem from belonging to social groups, and autistic individuals really struggle to find their group, to find their people. That's why we have, AFO has socials for young adults so they can come together with other autistic individuals and network and try to build friendships, because they really struggle with building meaningful relationships, finding their significant other at times. And these struggles can also lead to mental health conditions. Let's talk a little bit about some evidence-based interventions and supports. So we've moved away from specifically talking about mental health, and now we're just looking at autism in general. Early intervention is key. And so I know that I had mentioned that some children are being diagnosed as young as 12 to 18 months. So getting that early diagnosis helps, because you can then put supports in place. And these supports can help with learning, communication, social skills, and overall brain development. So let's just hit on these more common supports. And there's so many things out there, but these are what you're going to see most commonly used. Speech and language therapy. This is going to address challenges with language and communication, and it can help people with autism improve their verbal, nonverbal, and social communication. And the overall goal here is to help that person communicate in the most useful and functional way that they can. Occupational therapy is going to work on cognitive, physical, social, and motor skills. And the goal is to improve everyday life skills. Okay, so this can help a person become independent or more independent and participate in a wide range of activities. OT programs really like to focus on, for kids, play skills and learning strategies, as well as self-care. And it could also help manage sensory sensitivities and issues. Physical therapy is also helpful because, in addition to developmental delays, a lot of children with autism have low muscle tone and they have difficulty with their gross motor coordination, like running, kicking, jumping, throwing, things like that. So if a child can get into physical therapy, it can help build their muscle strength and their coordination, which is overall helps with everyday life activities. And then applied behavior analysis, or ABA. This is a therapy based on the science of learning and behavior, and it's known to help kids increase language and communication skills, improve attention and focus, help with social skills, memory, even academics, and decrease behavioral problems. ABA is becoming a little bit more controversial. So with all of these supports, I just want to say, you do your research with your child or your client and have a really good conversation of what you feel like works best for that child. You want to individualize any of the supports that are put in place. And so let's move into some positive tips for interaction, because I feel like this is really important when working with autistic children or teens and adults. There are no fixed rules on how to communicate with a child with autism, but many autistic individuals, family members, and experts recommend these tips. So you want to use familiar cues, ask questions, observe what's working best with that child. Like if you're a provider, maybe you are providing counseling services or whatnot, be sure to observe mom and dad or the caregiver and what's working best with the child, or simply ask. You're also going to want to avoid what doesn't work. So you want to identify those triggers and try to put things in place to avoid those. So interactions can go smoothly. You want to be patient. Sometimes kids with ASD need longer to process information, so you may need to slow down the conversation, maybe pause, maybe just stop the questioning and go back to it later. And remember to always use positive reinforcement, because kids with ASD, they really love for their good behavior to be rewarded and talked about. So always compliment good behavior and use clear, straightforward language. What we found is that a very clear, calm, and positive tone of voice works best. Even in those most stressful situations, that's when you really want to check yourself and make sure that you are presenting yourself and your voice and your body in a calm manner when working and interacting with an autistic child. And move slowly and explain your next move. Kids with autism love to know what to expect, especially if they're going into an unfamiliar situation. So you're going to want to tell them, where you're going, what's going to happen, how long they're going to be there, who they may see, what the time limits are going to be on things, because a lot of them can, I know my child can get very caught up in, well, how long is this going to take? When is it going to be done? All of those things. You'll hear a lot of parents of autistic children or caregivers give warnings. So you'll hear them say perhaps they're going to go to the grocery store. They'll tell that child, in 10 minutes or 15 minutes, we're going to have to go to the grocery store. And then they'll do a countdown. You may hear some say in 5 minutes and in 2 minutes. So this is just trying to help because there's going to be a change in routine. A lot of autistic kids don't do well with change. And so you're just providing information to try to help that transition be as smooth as possible. And use positive recommendations or positive cues. Children do really well with, things like you're doing great job, or if they're getting upset, maybe use take a deep breath, things like that. And redirection is really good when interacting with autistic children, especially if you can feel behaviors building or maybe a meltdown's coming. Trying redirection. And what I like to use is that narrow or limited interest we talked about earlier. If you can find out what that is early on and use that with a child to redirect the conversation, get their brain off of thinking about whatever's bothering them onto thinking about something that they love. So if you have a child that they love dogs, for example, that's their passion. If you can start a conversation, just very light conversation, talking about dogs, maybe asking questions about dog breeds or whatever. It could be airplanes, a certain television show, whatever. If you know that that child is passionate about that topic, use that for redirection. Also, interacting with autistic teens and young adults, what we just talked about also works, but try not to use words that are too personal, like sweetie, cutie, baby, honey, things like that, because at this age, they are trying to establish their independence, and this could come across as babying them or being demeaning or disrespectful. So treat them like a peer or like a young adult. Say what you mean. Autistic individuals need to be spoken to with very literal, clear, and concise words, because sometimes slang or sarcasm can be confusing and not easily understood for people on the spectrum. Not in every case, but in some cases. So just be sure that you're using very literal language, and take time to listen and get to know them so you know what works and doesn't work for this individual. And give time for a response, just like we talked about with the kids. It may take time for them to process information, and always provide meaningful feedback that's honest, non-judgmental, and clear. Help them learn how to safely navigate complex social interaction and conversation, because like we've already talked about, it can be a struggle for many individuals with autism. So building that type of relationship with them and trust, where they know that they can talk to you and that you're not being judgmental and that you're someone that they can trust, always will help. And do not speak as if the person is not in the room. So if you have an autistic teen, maybe you're a parent or a caregiver or even a professional working with an autistic teen, and you're talking to someone else, maybe it's a teacher or a physician, make sure that the two of you are not carrying on a conversation and leaving them completely out of it. Let them be able to give some input and some feedback about what you're discussing, especially if it's about, their life, their health, their behavior, things like that. Let them have some input and give them some control. We've talked about now tips, but let's move into 5 areas of focus for interaction. First off is communication. It's always important to remember that behavior is communication. It's kind of like an iceberg. The behavior is an iceberg. Think of that. So what you're seeing at the level, at the top, is the iceberg. This is the behavior. This is what's happening. But remember that underneath that, what you're not seeing is something that's going on that's making that child communicate through this behavior. They could be feeling confused, sad, angry, whatever. So try to get to the underneath to figure out why they are communicating using this type of behavior. So the first area of focus is communication. We need to remember that this is the person's way of telling what they need, what they're thinking, their ideas, all of that. And it's important to remember that communication occurs way before the person speaks. Some communication tips. When communicating with an autistic child or young adult, simplify your communication, be direct, tell exactly what you need them to do or what the expectation is, give them time to respond and process the information. And it's always good to use visuals, which we'll talk more about in just a moment. And if the conversation is becoming overwhelming for them, it's good to just take a break. Remember that breaks are okay, and let them have time to just maybe decompress and think about things and then revisit the conversation. Number 2 is motivation. So when you're trying to motivate a child with autism, remember that social challenges may prevent them from being socially driven. So like what I'm saying is, if you're wanting to motivate a child or whatnot, you may not want to use social things to motivate them or taking social opportunities away from them because they may not care. Motivation leads to learning, so keep that in mind, and it can increase connection and trust. And you must learn more about the child to know what is reinforcing to them. So you've got to know them to know what motivates them. So you want to individualize the motivation. And the most important thing to remember is that motivation is not bribery. So if you have a child throwing a fit in the grocery store or in your office, saying, if you stop throwing a fit, I will give you this. For like a parent, it would be in the grocery store and you say, if you stop throwing a fit, I will buy you a toy or I will give you some candy or whatever. That's bribing a child. Motivating a child is planning ahead. If you have a child that you know is going to act out in a certain situation, having a conversation with them ahead of time and telling them, if you can get through this appointment or if you can get through the grocery store without any behaviors, then, I will give you $5 or buy you a toy or whatever it is. Like I said, it has to be individualized to that child and what works for your situation. Also save the strongest motivators for the toughest times, even if that's giving a child a sticker or whatever. It can be something very small. If you're motivating them with anything, just remember the toughest days and the hardest days, you need to give more motivators and more reinforcers. And for those moments that they're not really that agitated, they may, or that that they're not going to be that agitated about, they may not need motivators. But you're going to learn and get to know this ahead of time so you can individualize these in these moments that they need it. And number 3 is get visual. Many autistic individuals have better visual processing than auditory processing abilities. So it's really important to have some visual things in place because that can help a child, even a teen or an adult, understand routines and rules. And it can be used for not even routines and rules, I mean that too, but transitions, learning activities, helping them stay on task. There's so many things that you can use visuals for, but remember to make it age appropriate because what's going to work for a 7-year-old is not going to work for a 16-year-old. So just keep that in mind. These are just some examples. These are from a classroom, but it's just to give you guys a visual on what we're talking about. So first then is a great one, especially for little kids. You can customize these for whatever you're wanting it to look like. For a family, you can have first then charts where you say, first you're going to do your homework and then you can have a video game time or free time or whatever. So it can really work in any situation. You just have to know that child, and then you can print out pictures and put Velcro on it, laminate it, however you want to do it. But these can be really helpful. Visual schedules are also helpful. Like I said, this is an example from one of our early childhood trainings, but you can customize this to help with any situation. It doesn't just have to be a classroom. For a family, you could make a visual schedule for a child for when they get home from school, for example. When you get home, there's snack time, then there's homework time, then you can have free time or TV time. There's dinner time, bath time, bedtime, however you want to do it, whatever you're trying to accomplish with that child to try to help with transitions, to help with the day go smoother. That's why these things are so important, because we've already talked about autistic children love to have a plan. They like to know what to expect. They do really well with routines. So putting all of this together in one place can be really, really helpful. Number 4, clear and predictable routines. These types of routines, when you use all of this together, it gives a child a sense of control over their environment. It helps them feel safe. And when they feel safe, they're more engaged, they're more relaxed, there's less anxiety. It creates a sense of belonging. So having clear and predictable routines is extremely important for autistic kids. So let's talk about a few tips for creating routines. Once again, you need to base it on the child's age, and you need to individualize it for what works best for that child and your family. Or if you're using this in your office, maybe you're visiting with a child and you're wanting to accomplish something at the end of each visit, but you know that they can't get through an entire hour without some other things going on. This is where you're going to want to create a routine for kind of what you want that visit to look like. So at home, for you parents and caregivers that are on, you're going to want to have consistency in mealtime, free time, homework time, bath time, bedtime, whatever it is that you do during the day. If you want to incorporate chores or extracurricular activities to this, that's fine. But just remember to balance active time with quiet time and group time with alone time. Autistic kids, especially what I noticed with my daughter, was in middle school and high school. They need quiet time. They need alone time. After being in a very crowded, loud, active day, especially with a lot of social interaction, it's really important for them to be able to decompress and maybe just kind of self-regulate. So just keep that in mind. You might want to build that into the routine to make sure that they're getting what they need. This is great for their mental health as well. And I already said it, but I'm going to say it again. Consistent routines are key. If on Monday evening you come home from school and you allow the child to have 4 hours of video game time and you get off the routine, it's going to be difficult then on Tuesday to come home from school and have them do snack time, homework, then free time, then, family time or dinner time. So just be really consistent with routines. Sensory supports is number 5. Sensory supports are very important for individuals with autism because there's a lot of sensory sensitivities that happen throughout the day, and they are going to possibly experience sensory overload. And what is that? Sensory overload is when the brain has trouble organizing and responding to information from the senses. It can be the way things, like we talked about earlier, look, smell, sound, all of those things. And this results in overwhelming their brain's ability to cope or understand the input. Things in the physical environment may trigger a sensory overload response, and it's important to know that everyone has different sensory preferences. So if you have one child or one client that has autism and they're very sensitive to sound, you may have another that you interact with that is not bothered at all by sound. It may be lighting that bothers that individual. And that's why we say everyone is different. There's my alarm saying that we only have 15 minutes and I have a lot more to cover. So I'm going to kind of go through this quickly. We may not have as much time for questions, but I'll give you guys my email to email me questions. So what are common triggers of sensory overload? Bright or flashing lights, loud or sudden noises, noisy environments. It may even be distracting or annoying noises. It may not be loud at all. Crowds, clutter, strong smells, confusing situations, unfamiliar places, and very drastic environmental changes like a change in lighting, temperature, or noise. Also, tactile triggers like scratchy or uncomfortable clothing that people come in contact can also be a trigger. And what are some common cues or symptoms? If you see some of these things occurring with your child or with your client or with someone that you're interacting with that has autism or sensory sensitivities, you're going to know that these are the signs that sensory overload may be about to occur. So lack of focus or irritability, difficulty communicating, maybe the individual was communicating and now they're not. You see signs of anxiety or fear. Maybe they're covering their eyes and their ears. Perhaps they're rocking back and forth, fidgeting, they're becoming very jittery. Maybe they're pacing or toe walking. Some individuals have so much stress about certain social situations that they avoid those activities and spaces altogether. Also, another really common one is if someone is chewing on a non-food object, you know that something in the environment or in their space may be uncomfortable for them, or they may be experiencing some anxiety due to that. One of the more common ones is if someone's chewing on their clothing, their hair, or even maybe like their knuckles or something like that. Okay, this is a sensory kit. AFO has sensory kits that we offer. You guys can go to Autism Foundation of Oklahoma's website and check these out. I think it's autismfoundationok.org. That's our website. So if you want to check these out, but I'm going to tell you a little bit about the tools that you can use. Visual communication cards are very helpful. Pen and notepad also extremely helpful. Some people they may be able to communicate, but in a certain situation, the communication is broken down. And so these are the things that can really help with communication. Weighted lap pads and blankets, we have found that those are very helpful if someone is irritable, overwhelmed, or having trouble sitting still or focusing, because a weighted blanket can calm the central nervous system and really help someone that's experiencing a lot of anxiety. Noise canceling headphones are excellent for people that are experiencing some discomfort from noise, whether it's loud or distracting or whatnot. If you see someone with their hands on their ears rocking back and forth, noise canceling headphones can be a really great option to soothe that. Sunglasses are great for sensitivity to bright lights, flashing lights, or even glares. The sunglasses simply reduce the intensity of the lighting. Fidgets and other sensory-friendly objects or products, those are going to help as a tactile reward for those that are struggling with self-regulation. So sensory items can also be a great distraction. So if you have someone that's very fidgety or very jittery, giving them something to put in their hand and focus on can really help alleviate some of the stress in certain environments. And then we always say, I always like to use waiting rooms as an example for this, but in situations when someone is just waiting and having some anxiety, not only do fidgets work and sensory-friendly products, but also coloring books, word puzzles, activity books, things like that. And real quickly, I want to hit on Meltdowns versus tantrums. If you have someone that is experiencing sensory overload, you want to try to remove them from that space and that environment if possible. You don't want them to hurt themselves or anyone else. So if you see these things happening, or now they are in what we call meltdown, it's going to look different than just a tantrum. So if you can get them to a quiet, safe space, it's great. But what you're going to see is an individual is going to be overwhelmed and overloaded. Their communication may be broken down, and they're not communicating. They're not coping. They're in extreme distress, and they're not in control, and they do not want attention. Okay. Why this is different than a tantrum is goal-oriented. Someone is negotiating a situation. They're very aware of their actions. They're wanting to manipulate a situation to get something that they want, and they do want attention. So these are two very different things. During a tantrum, you are not going to want to use that time as an example to tell that person that this behavior is inappropriate. This is not a teaching moment. They're going to need time and space to work through this, and then maybe later you can have that conversation. So it's just good to know the difference and what these two things look like. So 5 additional tips for de-escalation. So if you have someone that is in a meltdown or having a really hard time, remember to stay safe and give space, which we've kind of already talked about. Check yourself. Make sure you're calm, connected, and caring. Because if you go into the situation and you're angry and your voice and your body and your face is showing that you're angry, it's not good for anyone. So model calm, make sure that you have all of yourself in check and you're relaxed with your voice and face and body. If someone is already in meltdown, a lot of this isn't going to help, but if you're going in that direction and you want to get in front of it, offer choices, get visual, empower the child, and offer support. Do not make accusations and don't discuss the problem like we were talking about earlier. It's not a time to discuss why this is inappropriate or talk about potential punishments and things like that. Ask yourself, is this sensory overload? And if it is, what tools can I put in place to help this individual de-escalate? And this is the escalation curve. So if you have someone that is becoming agitated and you see that this is happening, they reach that peak, you have to give them time to de-escalate. And time is what it's going to take. You saying, this is not okay, stop this right now. That doesn't work, okay? So just give them time to de-escalate and then recover. These are some references that we use to put this presentation together. If you guys want to do more digging on this, this was a lot to fit into an hour. And so I kind of feel like I rushed through some of it. I think we could talk on this all day, but these are some of the references. And here is my information again. That QR code is my digital business card. And then I just put my email on here because I don't know if we'll have time to go over all of the questions. So feel free to email me with any questions that you have, even if it's something that you think about down the road. And thank you very much. So that is my presentation. So let me close this out.
Thank you so much for that. As you can see, we have posted the link to the evaluation in the chat, but if anybody has any questions, specifically, you are welcome to put them in the chat. I can ask for you, or you are welcome to unmute and kind of ask your questions in the remainder time that we have. We have about 7 minutes. Just wanted to say that evaluation link is in the chat. We will upload the slides that we have available to our resource database. That is also going to be uploaded. We do ask for a few days for that, but all of those links are there. We do have a question. Are there any resources for Spanish-speaking families?
Yes, we do have some resources and we always can help individualize those if you guys want to reach out. Like I said before, our website is autismfoundationok.org. So you can check out our website. And then if you want to reach out to us for individualized resources, please do so. We have a resource coordinator on staff. His name is Matt. You can find his information on our website or reach out to me and I can connect you. But Matt is wonderful and he's developed an entire resource guide to help our families and professionals also out there navigate autism and be able to find what they need.
Fantastic. And I think a follow-up to that was, what about some Tulsa specific resources and maybe some Spanish resources in Tulsa? So I think it kind of goes with connecting to him as well.
Yes, absolutely. He has the entire state mapped out. So regardless whether you're OKC area, Tulsa, or a rural area in Oklahoma, we have resources for literally the entire state.
And for the questions about where is the PowerPoint going to be uploaded, that will be uploaded to the resource database, which is where you will find your CEUs, your foster care credits, your certification of attendance, all of those things as well. So that will be in a link. We'll kind of have a whole folder for today. And if there are any other resources that I'm able to obtain, maybe from him, if I can get some of those resources mapped out, I'll get those uploaded as well.
There's also a question about testing sites listed on the website.
I do not know that information right off the top of my head. What type of is it a specific type of testing? Is it, are they talking about getting tested for autism specifically?
That's how I'm reading it, but it was
Okay.
a comment in the chat, so I'm not sure.
Yes,
Yeah,
I'm
it's for an
assuming.
AFD diagnosis.
Yeah, okay, that's what I was thinking. That's what I was thinking that they were asking about. Matt has those. What he has done is he's gone through and put all of these resources together. And every time that there's new resources, we're constantly updating that. So what we had put together 2 years ago has grown significantly because we've been able to network and learn more, and more people are reaching out to us and sharing their information with us. So I think the best thing to do would, if you want to know where a particular testing site is or who does testing, is to reach out to us and give us your location in the state, and then we can give you a list that's specifically for what you're looking for.
Awesome, thank you.
Oh, I just saw something pop up about my email. Yeah, it's ccott@autismfoundationok.org. If you want to put that in the chat. And like I said, if you have information that you want to share with us as well, you know, Matt's always adding to our resource guide. And so please share that with us as well. And also all of our programs. I focus on children and youth and health and safety, but we have those other programs. So if you guys are interested in learning about something from one of our other areas, please reach out to us.
Any final questions that we have for our presenter today?
Were you gonna put that email in the chat?
Yes.
She moved too fast and I couldn't get it written down.
Absolutely. Will you say that for me again?
Yeah, it's CCOT. I guess I could have typed it in there. I was just focused on the questions. It's CCOT at Autism Foundation autismfoundation.org.
Perfect. I knew it was, I didn't want to type it in wrong. All right. I just added that into the chat as well as a couple of those links as well for any of those resources that we have.
Okay, well, I think if we don't have any other questions, I just wanted to say thank you to Shandy for presenting all of this information to us. And if anyone has questions, please reach out to Shandy, and she will help you get those things answered. Thank you guys so much for joining us.
Thank you.
Thank you.